What type of really benefits does RPM have, even outside just collecting that data, collecting the vitals, what it may mean for the patient's family?
So, of course, we know it's preventative medicine, but it also helps treat those who have chronic conditions. But what I will say is when we think about illness, we think about the patient. We never really think about how it affects the family. So, for example, if you have a single mom and she's the only person that's caretaking for, we'll say her grandmother, if she gets calls where she has to leave work, where she has to grab the kids from school, it becomes a ripple effect. Not only is the patient being affected because they don't have the access to the care, but the family's being affected because of the constant drives and visits to the hospitals and the doctor's offices. It impacts their life, jobs, education, things of that nature. So having a preventative digital health platform may help decrease some of that burden that's put on the family.
Because often patients don't want to burden their families either. I think one thing that stuck out to me with working with one of our pilot stores early on, some of the feedback they got from the patients that were involved in the program, they were so thankful really to have, I want to say, the attention to their health care. Like maybe it was difficult for them to get a hold of their physician on a regular basis. And it gave them peace of mind too that their condition is being managed and that they don't feel as much of a burden as well.
And I agree with that 100%. And I can kind of highlight on that. And we had a patient who she really adored her health coach, and her son was a doctor. And she would say, I don't want to call my son. He's busy in practice all day, but I just don't feel right. Something's wrong. And I can't get a hold of my doctor. And a little research, that doctor was covering two independent livings in that area and then was a primary care doctor as well. So, she told the health coach, I really appreciate you being able to monitor my blood pressure. I don't feel pressured to go to the emergency room when I know you're watching. And I know not only are you watching, the pharmacist is watching. And when I say health coach, that's usually pharmacy technicians. And then she also said, I know that you two are watching and that if anything goes wrong, you will reach out to my provider. So they really depend and count on that care.
Oh, that's a great example. That's a great example. Thank you for taking a few minutes to discuss this today. Again, if you're a pharmacy and would like more information on remote patient monitoring and our iCare Plus RPM platform, don't hesitate to reach out to Ashley. That's what she's here for. She loves to work with pharmacies and get them set up on RPM.
Thank
Thank
you.
you.